Welcome once again to our interesting medical column, Ask the Doctor. I'm Dr. Wale Okediro, a family physician of about 45 years in practice. I'm going to answer questions sent to me by my patients. There are 8 questions in this series, and the first question has to do about losing weight. And the question goes like this: I have remained seriously overweight despite all my efforts to lose weight. Kindly let me know what to do about this. And my answer is this. I said many factors contribute to weight gain. The obvious ones are poor diet and lack of exercise. But age is also an issue. As you get older, it is easier to gain weight and tougher to lose it. Why? Because as you grow older, your lean muscle mass declines over the years and the change becomes more noticeable after age 40. Muscles burn calories all the time. If you have less muscle, your body burns fewer calories, which can lead to easier weight gain. A man's ideal weight is usually about the amount he weighed at age 20. And we use what we call BMI, body mass index, to measure both height and weight. And that will tell you whether you are overweight. Your BMI might remain relatively stable because you have more body fat and less muscle mass. Still, the BMI is a clue as to whether you need to lose weight or not. Waist size is another way to gauge weight gain, but you have to look at how much of weight you have around your waist to know whether you are going better or not. A few small diet changes can help you to lose weight. First, take a look at the kind of beverages you drink, like juices, mineral waters, or sodas and other sweetened beverages. You have to reduce them. Many unhealthy simple carbohydrates are liquids which are often high in calories, and this is very important. Simply eliminating sugary beverages from your diet is a great way to start to lose weight. Next, look at the refined grains that you eat. Refined grains mean white rice, white bread, pasta. These ones, they are very difficult, they are digested slowly, but can keep your blood sugar very high. They also have more fiber and various essential nutrients. In terms of calories, you must focus on not overeating during meals. That is, during your meal, morning, breakfast, lunch, or dinner. That is when you have to stop, you have to reduce your habits. You can reduce the portion of the food you eat. And then it's also good not to be eating while you are watching television, because while you are watching television, you can eat a lot without your knowing. Then you must stay active to burn enough calories by walking, by doing some health exercises. By doing all this, it will help you to lose weight. Then the second question is, I've heard of a new form of treatment for depression and anxiety through the use of radioactive rays. Can you let me know how effective this is? And I said the radioactive rays you are talking about is what scientists call transcranial magnetic stimulation. It's a therapy that is non-invasive. It's a new approach where this some machines are set to the skull of the person, and then powerful magnetic fields are transmitted to the head of the person like a wave. This specialized coil generates magnetic fields, and then the field can safely penetrate the skull and stimulate nerve cells within the brain. By targeting these nerve cells, it can regulate the mood, because depression is a complex form of illness, and it can it can be treated in many ways, like medications, psychotherapies, and all kind of thing. However, this new method, the TMS therapy, is been very effective. So it is important that you find out from the teaching hospital or specialist hospital nearest to you whether this TMS therapy is available. TMS, like I said, is called transcranial magnetic stimulation. It's doctors that can recommend it, but you can find out from them. Then the third question, he said, my 55-year-old father has been suffering from swollen feet for a long time. Can you let me know what can cause this and how to help him? And my answer is that swollen feet, called edema, is a term used in medicine to indicate swelling brought on by the buildup of extra fluid in body tissues. It takes place when there is an imbalance between the removal of fluid from the blood vessels and the removal of fluid into other parts of the body. This fluid buildup causes the damaged tissues to expand, resulting in swelling and tightness or heaviness in the area affected. It can occur, you can see swelling in the legs, in the ankles, feet, hands, even face and abdomen. Again, it can also occur in other parts of the body. And common causes of swelling includes gravity, especially in lower limbs. If you have been sitting for too long, as somebody who has been traveling long distance in a bus or in a plane, the swelling can occur in the lower limbs. We can also see some degree of swelling during pregnancy, during heart tissues, kidney problems, liver problems, and injuries, as well as malnutrition, or in some cases of diabetes. And these can occur. If this swelling persists or is severe, it is always advisable to seek medical attention so that the underlying causes can be found out, can be discovered. While moderate edema can be a transient thing from prolonged sitting or sitting, it is crucial to remember that when this edema continues for a long time, it could be due to some underlying medical ailments which must be diagnosed. Since your father's problem has been on for a long time, it is important for you to seek medical attention for him. Then the fourth question, it says, what are the signs of prostate cancer? He said, since my father died from prostate cancer, I've been afraid that I may also have prostate cancer. In view of this, I would appreciate if you can tell me how I can know the signs of prostate cancer so I can start avoiding it. Well, my answer is this. I said medical experts, that is urologists, have confirmed that there are no symptoms that can physically warn you against prostate cancer. However, there are some noticeable signs that you must look out for. For example, when you see blood in your urine, when you are urinating and you see blood in your urine, you can start thinking of something about the prostate. Or you have pain in your pelvic bone, and you also go to urinate almost frequently, then you have to see a doctor to check you to know whether you have some prostate problems. Like I said, most men with localized prostate cancer have no symptoms, but some of them, but when the cancer becomes advanced, prostate cancer has become as advanced that it has spread to many parts of the body, and then they can start having bone pain, they can feel very tired, and then they can find it difficult to they can find it difficult to hold their urine, always going to urine. So there are so many tests that one can do. There's a blood test that you can do. When you go to see your doctor, he will tell you. And then there's also possibility, and then when you are examined, when the doctor examines you well, he can put his finger through your anus to check your prostate. He will know whether they are enlarged, or whether it's just smooth, or whether it's craggy hard. At which point, you will start thinking that maybe it's a prostate cancer. The next question, I want to stay fit. I'm about 50 years of age. Kindly let me know how I can keep healthy. He said, simply to stay fit, you have to avoid getting overweight. You have to eat moderately. Particularly if you can stay away from alcohol, because many of the alcohol you take make you to put on weight. Then it's also important that you should be very active. Reduce the time you spend just staying in the vehicle. You can walk instead, or early morning walk exercises. If you have the ability, you can go to the gym for exercises and weight training. All this one will keep you fit. Then if you know how to cycle, to ride a bicycle, that will also help you, because it will help you to lose weight. Then this question is also related to the prostate. He said, I'm a 60-year-old man. I noticed that I urinate more frequently, especially at night, and sometimes I dribble when after finishing the urine. My friend said these are symptoms of enlarged prostate. Please let me know the answer. And my answer is that when you have an enlarged prostate, you can have some of the signs you have given us. For example, difficulty in initiating urination. The enlarged prostate gland may cause a weak urine stream or make it difficult to begin to urinate. In addition, the enlarged gland may obstruct the urine flow, making some urine to remain inside your bladder all the time. So this one will have to be going to the toilet to urinate all the time. It is worth noting that these symptoms can also be caused by other conditions, like urinary tract infection. That is why it is important for you to seek medical advice for proper diagnosis and treatment, so that you will know what you are really having. The next question is indigestion. I have been having bloating of my abdomen with some pains in the upper part of the abdomen. I was told that it is indigestion. That is, I don't digest my food well. Can you let me know what to do about this problem? Well, in my answer, I said indigestion is a medical condition that can lead to discomfort in the abdomen, and it can be due to so many causes, including overeating, consumption of fatty or spicy food, excessive alcohol intake, stress, the use of certain medications, and also some infection can cause this. And this one can also be treated by finding out what is causing it. Just like I mentioned, it could be due to excessive food intake, it could be due to excessive alcohol or stress or using some drugs. So you have to find out what are the things you are doing that are causing this stomach to be bloated or to have indigestion, and then you have to correct it. Once you correct that cause, then the bloating will go down. Then lifestyle modifications can also help. That is, eating smaller and more frequent meals. You can also avoid foods that are too spicy, avoiding alcohol or stopping it entirely, and stop smoking, and also reducing stress. Try as much as possible to also go for exercises. The last question is from another 70-year-old man, and he said, I recently turned 70, but was surprised that unlike my age mates, I don't have any gray or white hair on my head. Can you let me know why this has happened and whether it is normal? Because my friends are showing off with their white hair. I also want to show off my own white hair. Well, my answer is that it's generally very unlikely not to have any gray hair at 70. The natural progression of hair aging means that as people age, their hair starts to produce less and less melanin, which is the natural pigment that gives hair its color. However, due to genetics and race, it is possible not to have white hair until very old age, as occurs in some families and in some races, such as the Romans, who are famous for having their teeth, smiles, and hairs very youthful even at advanced age. For me, I believe that the time will come when you will have your gray hair. For now, just continue to enjoy your dark hair. On this note, we come to the end of this episode of Ask the Doctor. My name, Dr. Wale Okediran, a family physician. Thank you. I will see you at the next edition.